Easing the lockdown restrictions will be based on keeping transmission rates low. And as we heard, one key measure is what's called the R number, which is a way of working out how many people might be infected by one person carrying the disease. Here's our science editor, David Shukman.
The lockdown stays in place, even though we seem to be over the peak of the crisis. Scientists advising the government say the restrictions are working, driving down the rate of infection. But they warn it could very easily shoot up again.
As soon as R goes above 1, then you restart exponential growth. It may be slow if it's just above 1, it may be a lot faster if it goes a lot above 1, but exponential growth restarts, and sooner or later, and the higher it is, the sooner it is, the NHS will go back to the risk of being overwhelmed and the numbers of cases will tick up.
What's called the R number is a way of measuring how easily the virus spreads. So if the rate is 1, that means anyone infected is only passing it to one other, so things are stable. But get to a rate of 2, and people infected are passing it to 2 others, so the outbreak accelerates, and that's what potentially can overwhelm the NHS. Get to a rate of 3, and things are even worse. It's what we had about a month ago, and only drastic action of the kind we're seeing now can bring it under control. Right now, it's estimated the rate is between 0.6 and 0.9, crucially below the line of one person infecting only one other. It's thought that reopening schools could possibly add about 0.2, though no one can be sure. Allowing public gatherings again might add 0.5. That would take us above the line of 1. And scientists reckon that relaxing the lockdown entirely would add 2 to the rate, taking us right back to the worst of the outbreak, which is why it's likely that'll only happen in careful stages. Estimates for the R number are based on people needing hospital treatment, so they're not exact, and the infection rate varies across the UK. One of the government's own advisors says the R number is not the whole story.
It oversimplifies the metrics. And the problem is that the message can be, well, R is less than 1, everything's under control, let's go back to normal. And it's not like that, because you could still have a problem in Newcastle or Liverpool, and that problem will be quite severe.
With so much about the virus uncertain, every government is being cautious. Germany has allowed small shops to reopen, but the authorities are watching to see if that raises the infection rate. They'll review the measures next week. And all the time, there's the risk of unexpected spikes in infections. Singapore is rushing to create 4,000 more hospital beds. Tackling the virus means remaining constantly on the lookout. David Shukman, BBC News.
When the lockdown is eventually lifted, it could be some time until the economy is back to normal. And if social distancing is here to stay, some people might still be unable to get back to work. Alex Forsyth has been to Warwickshire to find out how people are coping.
Things are looking pretty bleak for many businesses. Ulster, like many towns, is mostly empty, and the financial impact of this pandemic is being felt far beyond the high street. Angus and his wife run a local plumbing and heating firm.
We've put everything into this business. It's a really anxious time.
They're still doing emergency work, but business has dropped by 80%. They're making use of government schemes to support staff. But even when restrictions ease, they fear working safely in small spaces will be hard and recovery could take a while.
If people are fearful of jobs, they won't have the confidence to spend, £5,000 on a boiler. It's going to take a long time to get back on its feet, I think. We're going to struggle, but it's nothing in comparison to a lot of other people. We haven't lost any loved ones, but we are concerned about the future.
Many are trying to look on the bright side, even as economic reality bites. This is a quiet Coventry.
I just hope that we can get back to some sort of normality soon, because I don't know about anyone else. I just don't know how long I can keep going on.
Sarah's been a mobile hairdresser here for 13 years. Now she's at home, business on hold. Her husband, who did work in a hotel, is getting most of his wages paid by government, but it's still a struggle.
Earning, I don't know, between £200, £300, £400 a week, to suddenly then losing that and not having any income, it's just hard. I mean, I got a bit of money in the bank, not a lot, but I mean, that's gone now anyway, but what do you do?
She's trying to stay upbeat, but simply doesn't know when she can start her business again.
So I just can't wait to get back to work.
Harvey feels the same. He's a driving instructor in nearby Rugby. He's had no income since having to stop work more than 5 weeks ago, waiting to see if he'll get government support, relying on savings.
It has changed the way we're buying, but it's the household bills, the energy costs, that sort of thing that we have to keep an eye on.
How long could you sustain from your savings?
Probably another 3 or 4 weeks, if that.
How are you feeling about it?
I'm trying not to, to be honest.
Having to share a car with students, he's not sure when he'll be able to safely work, but is trying to focus on the positives.
I think it's made me think that money isn't everything. The one thing I have done is taught my daughter to ride her bike, and you can't take that away.
Businesses, like most, are waiting to see how a new normal might work, conscious all the while the country's economic health faces a long recovery. Alex Forsyth, BBC News, Warwickshire.